Hey there, welcome to our channel. In today's video, we will be discussing sexually transmitted disease, its causes, how to prevent it and many more. Therefore make sure you watch this video till the end. However, before we continue, please like, subscribe to Kia Health and hit the notification bell to receive videos like this anytime we post them. Now let's look at today's topic. What is sexually transmitted disease? Sexually transmitted diseases (STDs) or sexually transmitted infections (STIs) are generally acquired by sexual contact. The organisms, bacteria, viruses or parasites that cause sexually transmitted diseases may pass from person to person in blood, semen, or vaginal and other bodily fluids. Sometimes these infections can be transmitted non-sexually, such as from mother to infant during pregnancy or childbirth, or through blood transfusions or shared needles. STDs don't always cause symptoms. It's possible to contract sexually transmitted diseases from people who seem perfectly healthy and may not even know they have an infection. Symptoms: sexually transmitted diseases (STDs) or sexually transmitted infections (STIs) can have a range of signs and symptoms, including no symptoms. That's why they may go unnoticed until complications occur or a partner is diagnosed. Signs and symptoms that might indicate an STI include: 1. Sores or bumps on the genitals or in the oral or rectal area. 2. Painful or burning urination. 3. Discharge from the penis. 4. Unusual or odd-smelling vaginal discharge. 5. Unusual vaginal bleeding. 6. Pain during sex. 7. Sore, swollen lymph nodes, particularly in the groin but sometimes more widespread. 8. Lower abdominal pain. 9. Fever. 10. Rash over the trunk, hands or feet. Signs and symptoms may appear a few days after exposure, or it may take years before you have any noticeable problems, depending on the organism. When to see a doctor? See a doctor immediately if you are sexually active and may have been exposed to an STI. You have signs and symptoms of an STI. Make an appointment with a doctor. When you consider becoming sexually active or when you're 21, whichever comes first. Before you start having sex with a new partner. Causes: sexually transmitted diseases (STDs) or sexually transmitted infections (STIs) can be caused by 1. Bacteria, gonorrhea, syphilis, chlamydia. 2. Parasites, trichomoniasis. 3. Viruses, human papillomavirus, genital herpes, HIV. Sexual activity plays a role in spreading many other kinds of infections, although it's possible to be infected without sexual contact. Examples include the hepatitis A, B and C viruses, Shigella, and Giardia intestinalis. Risk factors: anyone who is sexually active risks some degree of exposure to a sexually transmitted disease (STD) or a sexually transmitted infection (STI). Factors that may increase that risk include: 1. Having unprotected sex. Vaginal or anal penetration by an infected partner who isn't wearing a latex condom significantly increases the risk of getting an STI. Improper or inconsistent use of condoms can also increase your risk. Oral sex may be less risky, but infections can still be transmitted without a latex condom or a dental dam, a thin, square piece of rubber made with latex or silicone. 2. Having sexual contact with multiple partners. The more people you have sexual contact with, the greater your risk. This is true for concurrent partners as well as monogamous consecutive relationships. 3. Having a history of STIs. Having one STI makes it much easier for another STI to take hold. 4. Anyone forced to have sexual intercourse or sexual activity. Dealing with rape or assault can be difficult, but it's important to see a doctor as soon as possible so that you can receive screening, treatment and emotional support. 5. Misuse of alcohol or use of recreational drugs. Substance misuse can inhibit your judgment, making you more willing to participate in risky behaviors. 6. Injecting drugs. Needle sharing spreads many serious infections, including HIV, hepatitis B and hepatitis C. 7. Being young. Half the STIs occur in people between the ages of 15 and 24. 8. Men who request prescriptions for drugs to treat erectile dysfunction. Men who ask their doctors for prescriptions for drugs such as sildenafil, Viagra, Revatio, Tadalafil, Cialis, Adcirca, and Vardenafil, Levitra have higher rates of STIs. Be sure you are up to date on safe sex practices if you ask your doctor for one of these medications. Transmission from mother to infant. Certain STIs, such as gonorrhea, chlamydia, HIV and syphilis, can be passed from an infected mother to her child during pregnancy or delivery. STIs in infants can cause serious problems or even death. All pregnant women should be screened for these infections and treated. Complications. Because many people in the early stages of a sexually transmitted disease (STD) or sexually transmitted infection (STI) experience no symptoms, screening for STIs is important in preventing complications. Possible complications include pelvic pain, pregnancy complications, eye inflammation, arthritis, pelvic inflammatory disease, infertility, heart disease. Certain cancers, such as HPV-associated cervical and rectal cancers. Prevention. There are several ways to avoid or reduce your risk of sexually transmitted diseases (STDs) or sexually transmitted infections (STIs). 1. Abstain. The most effective way to avoid STIs is to not have abstain from sex. 2. Stay with one uninfected partner. Another reliable way of avoiding STIs is to stay in a long-term mutually monogamous relationship in which both people have sex only with each other and neither partner is infected. 3. Wait and test. Avoid vaginal and anal intercourse with new partners until you have both been tested for STIs. Oral sex is less risky, but use a latex condom or dental dam to prevent direct skin-to-skin contact between the oral and genital mucous membranes. 4. Get vaccinated. Getting vaccinated early, before sexual exposure, is also effective in preventing certain types of STIs. Vaccines are available to prevent human papillomavirus (HPV), hepatitis A and hepatitis B. The Centers for Disease Control and Prevention (CDC) recommends the HPV vaccine for girls and boys ages 11 and 12. If not fully vaccinated at ages 11 and 12, the CDC recommends that girls and women through age 26 and boys and men through age 26 receive the vaccine. The hepatitis B vaccine is usually given to newborns, and the hepatitis A vaccine is recommended for 1-year-olds. Both vaccines are recommended for people who aren't already immune to these diseases and for those who are at increased risk of infection, such as men who have sex with men and IV drug users. 5. Use condoms and dental dams consistently and correctly. Use a new latex condom or dental dam for each sex act, whether oral, vaginal or anal. Never use an oil-based lubricant, such as petroleum jelly, with a latex condom or dental dam. Condoms made from natural membranes are not recommended because they're not as effective at preventing STIs. Keep in mind that while condoms reduce your risk of exposure to most STIs, they provide less protection for STIs involving exposed genital sores, such as HPV or herpes. Also, non-barrier forms of contraception, such as birth control pills, oral contraceptives, or intrauterine devices (IUDs), don't protect against STIs. 6. Don't drink alcohol excessively or use drugs. If you're under the influence, you're more likely to take sexual risks. 7. Communicate. Before any serious sexual contact, communicate with your partner about practicing safer sex. Be sure you specifically agree on what activities will and won't be okay. 8. Consider male circumcision. There's evidence that male circumcision can help reduce a man's risk of acquiring HIV from a woman who is infected heterosexual transmission by as much as 60%. Male circumcision may also help prevent transmission of genital HPV and genital herpes. 9. Consider pre-exposure prophylaxis (PrEP). The Food and Drug Administration (FDA) has approved the use of the combination drugs emtricitabine plus tenofovir disoproxil fumarate Truvada and emtricitabine plus tenofovir alafenamide Descovy to reduce the risk of sexually transmitted HIV infection in people who are at very high risk. Your doctor will prescribe these drugs for HIV prevention only if you don't already have HIV infection. You will need an HIV test before you start taking PrEP and then every 3 months as long as you're taking it. Your doctor will also test your kidney function before prescribing Truvada and continue to test it every 6 months. If you have hepatitis B, you should be evaluated by an infectious disease or liver specialist before beginning therapy. These drugs must be taken every day, exactly as prescribed. If you use Truvada daily, you can lower your risk of getting HIV from sex by more than 90%. Using additional prevention, such as condoms, can lower your risk even more. Continue to practice safe sex to prevent other STIs. Enjoyed this video? Please like, comment, share with friends, subscribe to Kia Health, and hit the bell to receive videos like this anytime we post them. Wait. For more awesome videos, click the left or right video and enjoy. Thank you.